So in this video we'll talk of as to what are the clinical features and how the transmission and what about the treatment of this human metapneumovirus. So starting with when we look at the clinical features of this human metapneumovirus, that is the HMPV virus, it is having the similar symptoms what are seen in cases of the respiratory syncytial virus, such as coughing, sneezing, wheezing, rashes. The body ache can be there, fever can be there. Apart from this, there can be shortness of breath or and sore throat as well. In later cases, if the symptoms do worsen, the patient may even get into and the worsening symptoms may be presented in the form of bronchitis, pneumonia, or worsening of asthma. So basically, when we talk of this when we talk of this human metapneumovirus, what do we find is that this infection is most commonly seen in individuals who are of the younger age group, that is the children. They are more prone to catch this virus, that is children below the ages of 5 years are more susceptible for the infection of this virus, as well as the elderly age group. So above 60, 70, 65, 70, such elderly age group, as well as the people who are immunocompromised or have certain immunocompromising conditions such as diabetes, HIV. So such individuals, they are more predisposed to contracting this human metapneumovirus. When we look at the transmission mode, so basically transmission is through the droplet infection, that such as droplets of coughing, sneezing, as well as shaking hands and hugging, touching the contaminated surfaces such as doorknobs and phones. So these are the basic methods, basic modes of transmission. And do remember, when we look at the treatment modalities, your healthcare professionals, they as such, there is no viral treatment, no antivirals will work for it, except no and except for in certain cases if the patient is having secondary infections, secondary bacterial infections are there. So the healthcare professionals, they can even prescribe certain antibiotics to treat those secondary infection, but as such no antivirals will act. The most important, the method of treatment is, there is as such no specific treatment for the human metapneumovirus. The patient needs to stay hydrated, take plenty of fluids. Apart from this, the person should take proper rest, and over-the-counter medications for fever, pain and congestions can be taken. In severe cases, if this HMP virus has progressed, the patient is having difficulty, worsening of asthma or difficulty breathing, pneumonia, bronchitis, the patient needs hospitalization as well as IV fluids.